everyone, and welcome to our Monday Minute. Today, I want to share with you some hospice statistics that was reported in a Medicare report on hospice monitoring. These statistics are very telling and some things that you might want to consider. We will provide a link for you in this minute so that you can review all the statistics and trends and see how your agency compares. One of the most compelling statistics in this information is that the number of Medicare beneficiaries for hospice unique patients has not changed from 2021 to 2024. The total remains 1.8 million unique beneficiaries in those years. What has changed is the number of hospice days for those same patients. In 2023 was 137.8 million. In 2024, it was 147.2 million. So the number of hospice days has increased by 10 million, yet the number of patients has not changed. And so that is very telling in that our patients are definitely having longer lengths of stay. Now, having said that, that could be a good thing, it could be a bad thing. As you all know, in some situations, it's difficult culturally, in some cases, to get patients to elect the hospice benefit at the time that they truly need it versus waiting until it's absolutely necessary. Hospice beneficiaries have very short lengths of stay in some cases, and extending that length of stay is not detrimental. However, there is also a trend of hospices that are having to repay with the cap calculation, etc., because of extended lengths of stay for some patients. So it's a trend that you definitely need to monitor. The other trend I would like to point out is the hospice live discharge statistics. Of the total patients that had live discharges in 2024, 35% of those are revocations, and 32.9% of those are patients who were discharged no longer terminally ill. So the combination of those two is that 68% of all live discharges in hospice are due to either the patient revoking the benefit or the patient being discharged live because they are no longer terminally ill. Trends that you definitely need to monitor. Live discharges no longer terminally ill can be very confusing. There is nothing to say that you could not have a patient that was terminally ill, took a turn for the best, and you cannot document continuing that they are no longer terminally ill at this point. However, 33% of all live discharges being due to the patient being no longer terminally ill lends to the question, are these patients truly eligible for the hospice benefit when they were admitted? It is a very concerning number. The revocations being the highest reason for live discharges. If the patient is truly choosing to revoke the benefit, there's nothing you can do to change that, obviously. My concern is hearing hospices talk about a patient that goes to the hospital and they rush to the hospital to have the patient sign a revocation. You can never ask the patient to revoke the benefit. They have to tell you that they would like to revoke the benefit. So please be careful in that arena. But again, this statistic lends to if there are 35% of live discharges being due to revocation, what does that mean? Does it mean that patients are making decisions that they just don't understand? Are we again admitting patients that are not quite ready for hospice? What exactly does that number lend itself to? It is really important that we stay on top of where our agency is trending. Some of the detailed information in these statistics leans toward questioning where the hospice benefit is headed Does there need to be a revamping of how the hospice benefit currently works, etc.? And CMS is currently obviously evaluating that. Healthcare Provider Solutions is here to help with any hospice situation that you might need assistance with, whether it is evaluating your election process and the patients and how you analyze whether they are eligible or not, or whether you are simply looking for education, assistance with billing, etc. We just had our 2-day workshop for HPS Alliance members, and the recordings of those 2-day hospice workshops will be up on our website within the next 3 weeks. We hope you have a fabulous week, and thank you for listening today.